Yes, I'm ready, ma'am.
Both are ready?
Yes,
Okay, so if you've read and understood, consider and get communication skills station, please begin.
I
Hello,
will be
good
aggressive.
morning.
Okay. Good morning.
I'm Dr. Abdelgader, one of the surgical doctor here today. May I confirm your name and relation to the patient?
My name is Sarah, and I am his wife.
I'm
Aren't
really
you the
sorry.
consultant?
No, I am not the consultant. I'm really sorry for letting you wait all this time. Can you please take a seat so we can discuss your husband's condition?
No, I will not take a seat. I need to see the consultant right now.
I understand that you are angry now, and that is very understandable. But we need to I need you to sit down so we can focus on your husband case.
Okay, I will take a seat.
Okay. So, can I confirm that you are here with your husband knowledge?
My husband knowledge?
Yeah. I assume you are here with your husband consent to discuss his condition.
Yes.
Okay. So, we are very sorry for letting you wait all this time. Mr. Mann has been called, or the consultant has been called for an emergency. I'm here to help, and I'm here to explain everything to you.
How will you help? My husband was here 6 days ago.
I understand that your husband came here with large tummy swelling for the past, which was being present for the last 6 weeks. And for that, he was arranged for a CT scan. Unfortunately, the CT scan is out of service.
What is wrong with my husband?
Okay. The fluid inside his tummy is due to the swelling in his tummy is due to accumulation of fluid. The most common cause for this case is being cancer or malignancy. And also the test we are done for his fluid show that there is a cancer cells.
Cancer cells?
I'm really sorry.
So,
I know. Okay. You can carry on.
since it's confirmed to be cancer, what is the next step you will do?
Okay. I understand that it's difficult for you to accept such a news, but for now, we have to do the CT scan so we can make sure how much does this affect him, and we can be sure about the diagnosis itself. All we have now in our hands is just a test that show us there is a malignant cell or cancer cell.
And what will you do while the machine is not working?
We have some alternative. We can do ultrasound scan, which like a belly scan for pregnant women, the scan we do for pregnant women. It helps us to assess the amount of the fluid that is accumulated in his tummy. It also helps us to evaluate the liver. The liver is an organ that's located in the upper part of his tummy that may, if it is get infected, may lead to accumulation of fluid. So this would help us. Other
But you,
than, okay, so
but
you
you
can
will,
ask.
but you will need this machine anyway, right?
You mean the CT machine?
Yes, yes.
This is like alternative. We can use it for now. Maybe if the machine get fixed, we can go for this
So,
CT.
this is a small hospital that does not have all the facilities my wife needs it.
I agree with you. Yes, this is really a very small hospital without enough resources, and I'm really sorry for that. But I assure you, we didn't expect such thing to happen to our patient. As we are now in a safe period, we can wait for the machine to be fixed. And I assure you that it's totally beyond our hand. And if it isn't fixed in the future, we can go to any of alternative. I told you about one of the alternative, which is being the ultrasound scan, and the other alternative we can go for doing MRI scan. but it has the same effect as a CT scan, but we have to wait for Mr. Mann to do this. Another option, we can transfer the patient for another hospital to do this investigation, but also we have to wait for Mr. Mann to do this.
To allow this.
So what is your treatment option for him?
To tell you about the treatment option, we have to make sure that we are sure about the diagnosis. So we need to do further investigation. We can go to one of the alternative, or we can do wait for the CT scan to be fixed, so we can to decide what treatment he needed.
Can't we just remove it with surgery, this cancer?
I understand that you want what is the best for your husband, and I really feel for you. We do surgery when it is when we expect the patient to get benefit from the surgery itself, and we better avoid surgery in patient where we suspect they wouldn't get benefit of it. In your husband case, the accumulation of the fluid give an impression of advanced disease. So it is not it is not best for him to go through pain and surgery complication and stress. So that's why the surgery is not a good option for now.
But for now, he feels a bit breathless. Is there anything for this?
Yes, of course. This may be due to the accumulation of the fluid that's pushing against the lung. That's why it is difficult for him to breathe. We can arrange for withdrawal of this fluid, but we have to wait for Mr. Mann to do that. And we can go for medication that help us to get rid of this extra fluid.
Okay, so his brother, which is a cardiac patient, by the way, and living in the United States, can I call him to come to his brother?
And that is totally fine. But all we have now in our hand is a test that shows there is a cancer cell. So it is better to wait until we do the CT scan, so we would have a better idea about his condition. And my advice that he should contact his doctor to make sure that there is no risk of traveling for a long time for him, as ischemic heart disease have some risk with traveling. But at the end, this is your husband decision. It is his confidentiality, and you have to take his consent first.
Okay, shall I tell the family?
Family support is always encouraged. It is always good for someone to be around his family and understand why you want to call them. But as I told you, this is his decision and this is his confidentiality. I think you should discuss this with him and take his consent first about this.
Where this fluid in his abdomen, in his belly, gets from?
Okay, that fluid runs in our body like water running in a pipe. Sometimes due to obstruction of this pipe or this pipe can lead to accumulation of fluid.
So if he needs to be transferred to another hospital, will this be dangerous for him?
No, it is absolutely fine. It wouldn't be any danger to his life. But I think we have to try the alternative solution first.
Honestly, doctor, be honest with me. Is this cancer curable?
I understand your concern. I would answer this for you. But I am very sorry. To decide that, we have to know the exact diagnosis and we have to understand how much it affect him. For that, we have to do the CT and maybe other tests to tell you this answer.
Okay, doctor, thank you.
Good. Thank you.
Okay.
Just conclusion.
Okay, would you have any question or other concern?
No.
Please, if you have any question or concern, please don't hesitate to inform me, okay?
Okay.
Okay.
Good.